Morning, Daniel. Can you hear me?
Yes, Blake, I can hear you.
Okay, thanks. Just checking.
Are you logged in on your phone or are you on your computer?
I'm logged in on my computer for the meeting, but I'm using my phone for audio. I have a little more confidence in my connection.
Okay, perfect. I'm going to mute you though until the meeting starts.
Okay.
Okay.
Hello, this is Mark.
I'm here as well, Mark. This is Elaine.
Cool.
Good morning, this is Denisha. Can you hear me?
Yes, this is Mark Trail. I can hear you.
Thank you.
This is Elena Cummings.
This is David Cruz.
Russell Crutchfield is present.
Good morning, Denisha. Blake Fullenwider is on the line.
Good morning, Denisha. This is Roger Folsom.
Good morning.
Yep. Good morning, this is Frank Berry. I apologize for the technical difficulties. It is 10:31 and we will call let's see what the date is today, the April 9th DCH board meeting to open. Chairman Boyd is on the line but unable to speak with us, but he is on the line. One, I wanted to thank you all for joining today and also recognize the work of the frontline workers battling this virus. We have been in contact with most of the hospitals throughout the state of Georgia, and the work that they're doing is beyond incredible. And so I just wanted to take a moment to recognize their work. The other big news that I wanted to share was recognize the work of all of the state agencies, but in particular, the Department of Community Health team. They have done a remarkable job. I have been off-site in operations with the department and under Mariel and Blake and Joe and the executive leadership team, along with division leads, mayor plus ones, have kept the department going day in and day out, and really have not missed a beat. We began working from home, although I don't even necessarily like that term because that our team is in crisis and they're still doing the state's work at home. And so it's just been a remarkable experience to work with this team of people that are so dedicated to helping all of Georgia during this crisis. So I'll certainly make mention of that. The other critical piece that I felt was really important for you here is from our several of our leads of what we're doing as it relates to HFRD, from legal along with Medicaid and SHBP. So turn it over. We'll start with Blake to give you an overview of what the work that's been going on under Blake's leadership and his team. And again, when I say Blake, his team has done job supporting him. So Blake, I'll turn it over to you.
Commissioner, really
Thank you,
quick,
Commissioner.
can we please do just an official roll call before Mr. Fullenwider begins?
Yes, ma'am. I'm sorry, Denisha. Yes.
Okay. So I'll begin the official roll call. Again, I'll start with Chairman Norman Boyd. He will not be able to speak, but I do know that he's on the line. Elena Cummings,
Present.
Roger Folsom,
Present.
Anthony Williamson. Anthony Williamson. Rush Childers,
I'm here. I don't
Russell
think you can hear me.
Crutchfield.
Russell Crutchfield is here.
Thank you. Mark Trail,
Present?
Kenneth Davis. Kenneth Davis. And David Cruz.
Present.
Thank you. You may now
Great.
proceed, Mr. Fullenwider.
Great. Thank you very much. Thank you, Commissioner. Mr. Chairman and ladies and gentlemen of the board, it's a pleasure to give you an update today. And I just want to briefly echo the Commissioner's thanks to our team. They have done an incredible job. And when, we say that there's no playbook for something like this, there are no truer words than that. Over the past couple of years, we've gotten used to dealing with hurricanes and other natural disaster events, and those have become pretty much punch list, but this is far different than anything like that. And so I just want to thank our leadership team within Medicaid and SHBP. To walk through a couple of items, I'll start with Medicaid and Peach Care for Kids, the activities that have taken place in the past month or so. As you're aware, there are a number of avenues that CMS has opened to states in this emergency situation to request flexibilities. We are in the process of having received or in the final steps of receiving approval on actually 5 distinct submissions to CMS. One is a Section 1135 emergency disaster waiver that is pursuant to the Secretary's Public Health Emergency Declaration. We received approval on April 1st of the checklist items, as they have received these requests from just about, I think, all but one of the 56 states and territories. They have proceeded quickly to approve the punch list items, and we have a few other outstanding items that we continue to work with them on. We also have an 1115 waiver application that we've worked with them and submitted a revised 1115 yesterday. The same with a disaster relief state plan amendment that was revised and submitted yesterday. And we have 2 1915C Appendix K submissions, one for the Independent Care Waiver Program and the Elderly and Disabled Waiver, which includes our CCSP and SOURCE programs, and a separate Appendix K for our Now and Comp waiver programs. And those are very close to finalization and were resubmitted yesterday evening to CMS. As it relates to some of the operational flexibilities that we've put into place to address the unique needs of this emergency event, really a lot of it stems around telehealth and the need to practice social distancing. And so the telehealth guidelines that have historically been put into place have been broadly expanded. One is changing our definitions of originating site to include members to receive telehealth services from their homes as people shelter at home, and also keeping into place the ability for people to receive telehealth through a federally qualified health center, hospitals, pharmacies, ambulances, skilled nursing facilities, and related types of facilities. For the distant site requirements, we've relaxed the site requirements to include providers who wish to render services from their own home. or other settings so long as they can ensure the privacy and confidentiality of the encounter. We've also sought to expand the modality of communication to include not only video-based communication, which historically has been in place, but we're also allowing for audio consultations, recognizing the need there. We've included qualified providers to include physicians, mid-level practitioners such as nurse practitioners, physician's assistants, therapists from physical, speech, and occupational therapy, clinical psychologists, social workers, counselors, and behavioral health providers. For our home and community-based waiver programs, we've also allowed for telehealth to be used for member assessments, case management services, nurse supervisory visits, and level of care determinations. And we've tried to make the process for billing as simple as possible. Providers will bill as they would in the normal course of business, just including the place of service code 02 on the claim so that we can identify that that has been performed using telehealth during this period of time. We've also sought to make a significant number of changes to pharmacy policy. One is lifting refill too soon edits for 30-day prescriptions for maintenance medications. We are allowing for a one-time 90-day refill if the member does not have any refills available on a prescription and the pharmacist is unable to reach the prescribing practitioner. We're not allowing that for Schedule II controlled substances, but for all other maintenance medications and other drugs, that is allowable on a one-time basis. We're also extending prior authorizations from March 17th to May 1st for all maintenance medications except opioids to ensure continuity of supply there for the member. And there's also been a significant increase for asthma rescue inhalers, and so we've listed all asthma rescue inhalers as preferred with no prior authorization required through the end of this month to allow for an increase in availability of those to our membership. We'll reassess that at the end of this month to determine the next step in that regard. There's also been lifting of the signature requirements for mail order to allow for drugs to be dropped off at home with no contact with a delivery person. The same goes for durable medical equipment. We've lifted signature requirements temporarily for supplies that are delivered to the home. And we're also currently evaluating prior authorization policies for home oxygen per request in discussion with the Georgia Association of Medical Equipment Suppliers as recently as the last day or two. Also, provider enrollment is a big component of what we're looking at and ensuring we've got a sufficient supply to take care of our members. So for providers seeking to deliver Georgia Medicaid services that are new, we're lifting application fees, site visit requirements, temporarily criminal background checks, and also extending revalidation of existing providers who are up for revalidation during this public health emergency. We're also developing streamlined processes for license verification or enrollment through license verification and doing simply an electronic federal database check to check the OIG exclusions list and the Social Security Administration Death Master File to make sure that those check out and then can proceed to issue a provider ID number. We are clarifying that credentialing activities will occur. They will just be postponed until after the public health emergency declaration is over. For member eligibility, we are also seeking to make some changes there. We're suspending terminations through the duration of the public health emergency declaration, and we're also streamlining the application process to allow for attestation where documentation may not be available. In most regards, the one exception, which is pursuant to federal law, is citizenship verification, which in most cases can be done through an electronic interface with the federal government. Shifting gears to the state health benefit plan, we've likewise made a number of policy changes. First, on the commercial non-Medicare Advantage medical side of benefits, we're covering 100% of the cost with no member cost share for COVID-19 testing, 100% of office visits that result in a COVID-19 test, whether that is provided in a physician's office, an urgent care setting, or in an ER with no member cost share. The same for telehealth visits for medical or behavioral health needs that are performed either through the vendor's platforms, including Live Health Online for Anthem or virtual visits for United Healthcare, and also 100% of alternative telehealth visits that are provided directly by providers other than through those platforms. Likewise, on the commercial plans regarding prescription drugs, we've temporarily waived early refill limits on 30-day prescriptions for maintenance medications. We're waiving charges for home delivery for prescription medications, extending prior authorizations between March 23rd and June 30th for 90 days. And SHBP is introducing quantity limits on albuterol inhalers and for select drugs which have been present in the news lately, including chloroquine, hydroxychloroquine, Electra, and azithromycin, because of supply concerns there, national supply concerns. But we'll take, and that's in particular to ensure that members who are already taking these drugs maintain access to those drugs, for instance, someone with a diagnosis of lupus. For the Medicare Advantage SHBP retiree population, we're covering 100% of costs with no member cost share for COVID-19 testing, as well as 100% of costs for telehealth visits that are medical or behavioral health in nature that are performed through Live Health Online for Anthem and virtual visits for United Healthcare. And then finally, to touch on the Office of Health Analytics and Reporting, another critical function that falls within health policy. We are collaborating with the Department of Public Health for data matching where it's appropriate for Medicaid and SHBP to evaluate trends and to see what's happening as it relates to our membership and utilization associated with COVID-19 so that we've got a good comparison of pre-February 2020 and post-February 2020 and going forward so that we have insight into utilization and other trends that are going on. And we're also prepared to support data analysis as events unfold in the emergency period. So with that, Mr. Chairman, that concludes my presentation, and I'll turn it back over to you or the commissioner or the board to proceed. Thank you very much.
Blake, thank you very much. Jamie are all doing just a remarkable job of supporting you and everything. So thank you very much. Next, I'd like for the board to hear from Rachel King, our general counsel, to talk about the things that have been going on from that office, which have been just critical to keeping the system running. So Rachel, I'll turn it over to you.
Thank you, Commissioner. Good morning, board members, chairman. And just to echo what the commissioner and Blake said this morning about the world in which we are currently working. We're doing, we have an enormously, our staff is phenomenal. They're doing so much and more or less retooling our entire shop on a moment's notice, and have all been able to coordinate working from home with a lot of the work that they would normally do in office. As you may know, the Office of Health Planning has historically been a public-facing office. We have a window that people hand deliver their applications to, and as we were moving towards the telework environment, we put all of our applications online. So everybody in the state now has online access to all of our CON applications and forms. On March 20th, the governor issued an executive order authorizing the department to suspend compliance with OCGA 31640, which identifies what is considered a new institutional health service And that listing is also the listing that requires a certificate of need. So the state, the governor authorized us to suspend those categories, and the Office of Health Planning operationalized the order to facilitate a rapid response by the healthcare facilities to address the public health state of emergency that is presented by COVID-19 by creating a form and making it available online. We've got a very short form requesting confirmation of suspension, and we are receiving those from facilities. We're evaluating them. The reviews are being conducted, and decisions are being issued in those matters. So there's an enormous amount of work going on to facilitate that executive order while we're still reviewing the normal process for certificate of need, as well as other applications and requests as they come in. Our legal services section has coordinated with the Office of State Administrative Hearings to facilitate the continuation of hearings. They're doing all of our hearings telephonically, coordinating both with members and providers and the Office of State Administrating Hearings to make sure that we can continue moving forward with providing the appeal rights for those individuals. We're continuing our year-end contracting processes. So for the Office of General Counsel, COVID-19 is definitely here, and we are finding a way to balance that with the work that we're still continuing to do. Unless there are questions from the board, that will conclude my presentation, and I'll turn it back over to Denisha.
Rachel, thank you very much. And to the whole team, again, thank you. So many of our contracts touch a lot of our providers, and we're doing the absolute best we can to not miss a beat, and they've done a remarkable job. So, and Rachel's been involved in many other discussions as well, as we've tried to figure out creative ways to address some comprehensive needs of and the department as a whole. So thank you very much. Next up, Melanie Simon from HFRD will give an update on their activities, which have been just very significant, as you can imagine, as it relates to the oversight and regulatory and compliance issues. So Melanie, I'll turn it over to you.
Thank you, Commissioner. Good morning, members of the board and Mr. Chairman. Healthcare facility regulation has suspended routine survey activity. This was done in accordance with the suspension order issued by CMS on March the 4th. That was later updated by CMS on March 23rd, 2020. Pursuant to that order, HFRD is only conducting complaint investigations triaged at the immediate jeopardy level. Those would be situations that have caused or are likely to cause serious injury or death, or complaint investigations related to infection control or COVID-19 issues. We are following the same protocol for all licensed facilities, even those that are not CMS certified. So we have suspended routine survey activity at this time in order to focus our resources on the state's response to the COVID-19 public health crisis. We are making appropriate exceptions to this suspension to allow new healthcare facilities to open. We have been conducting some on-site surveys necessary to ensure that there is access to healthcare services at this critical time. We have also waived some on-site surveys where appropriate, and we have conducted some virtually. On March 18th, 2020, CMS released a new COVID-19 infection control survey process for nursing homes. And on March 19th, they released a similar process for other non-long-term care facilities, such as hospitals, dialysis clinics, home health agencies, and other healthcare facilities. HFRD has modified the CMS COVID-19 tool so that surveys may be conducted remotely by desk review if needed, and we are conducting COVID-19 surveys currently in assisted living communities, larger personal care homes, nursing homes, dialysis centers, and hospices. HFRD is coordinating this work with the Department of Public Health and the National Guard as part of the state's coordinated response effort to the public health crisis. We have also implemented, similar to the Office of Health Planning, an expedited process for waiver requests related to state licensing rules that is consistent with the governor's executive order of March 20th. And in addition, we have issued some blank rule waivers, two specifically that I would like to mention. We issued, effective March 20th, a rule variance for fingerprint criminal background checks. This variance is applicable to 8 facility types: adult day centers, assisted living communities, home health agencies, hospices, intermediate care homes, nursing homes, personal care homes, and private home care providers. The rule variance provides that individuals that are subject to a fingerprint criminal background check requirement may work immediately in the healthcare facility under general supervision once the facility has entered them in the Georgia criminal background check system, known as G-Checks. That is the automated system operated by the Office of the Inspector General, and completed all of the screening requirements except for the fingerprinting itself. The fingerprinting can then be delayed as part of a grace period until the state of emergency is lifted. This was necessary due to the closure of fingerprint locations throughout the state and the social distancing directives issued by the governor. In addition, to address staffing challenges in nursing homes, we also have partnered with the Georgia Healthcare Association and the Medicaid Division to launch a temporary nurse aid training program. This allows nursing homes to onboard new nurse aides that are not certified after an 8-hour online training course and associated skills competency checklist is completed, and following at least 2 hours of supervised training at the facility. This program was developed by the American Healthcare Association, and it was easier for us to implement this because we had already previously implemented online training for nurse aides in Georgia. We also, earlier in the week, coordinated with the nursing board to allow nursing students to participate in this program as well, as long as they have completed Nursing 101 and Nursing 102. They can also be immediately onboarded to assist with staffing needs at nursing homes throughout the state. HFRD, as you know, does have many clinical professionals that work on our team. And as such, we have many of our surveyors who are volunteering in various capacities to support the state's response efforts. We have nurses that are working hotlines for the Department of Public Health, some that are assisting in specimen collection at testing sites, and some that have been deployed to assist in on-site inspections in coordination with the Department of Public Health and the National Guard. We are particularly at this time focused on long-term care facilities and that vulnerable population, and we are working very closely with all of the stakeholders involved to do everything we can to ensure the health and safety of those residents at this time. So that is an overview of the activities of healthcare facility regulation. Thank you for the opportunity to share that with the board.
Melanie, thank you very much. As we wrap up the board meeting, I again wanted to reiterate the incredible partnership with the hospital association, along with the individual members that make up that association. They have just been beyond incredible to work with. When I tell you that they have been preparing for what we all are now calling the surge in the next couple of weeks, they have hospital beds available for us that can possibly be available, and being creative in how they do that, from Wellstar to Piedmont to Emory to Grady to Phoebe to Archbald to St. Joe's to hospitals all around the country, or all around the state, excuse me, and I know that's happening in the country as well. The partnership has been incredible. I also want to recognize the partnerships that we're having with the nursing home association and membership that makes up those associations. Russell Carlson, Tony Marshall, we're asking a lot of them, and we're all in this together. And so I want to recognize that association as well and the partnerships that we have with them. So, Mr. Chairman and members of the board, I hope this gives you a little deeper understanding of the work of the department and why, as I think you've heard now, I'm so proud of the team and couldn't be more pleased with what they're doing on behalf of all the citizens in Georgia. So with that, we will conclude the board meeting. Mr. Chairman, thank you for facilitating the meeting on the back end. I know you can't speak to the group right now, and making sure that all of our members were able to participate that could. I hope everybody has a great afternoon and a good weekend this weekend. I know we're all looking forward to a very meaningful weekend and thankful for our families and our friends and the colleagues that we work with. With that, we will conclude our meeting.